Hey everyone, welcome back to the Blueprint Nursing channel. My name is Nicole, and I'm a nurse here at Blueprint. Today, we're reviewing a next-gen NCLEX bow tie question. This new format can seem intimidating at first, but after watching this video and practicing some bow ties on your own, you'll be able to face them confidently. Let's break down what these new item types are, how to approach them, and some tips for success. Bow ties are graphic representations of real-life nursing scenarios designed to test your clinical judgment and decision-making skills. Before you get to the bow tie, you'll see one or more S-bar type tabs, like a nurse's note or a history and physical. Then, you'll move on to the bow tie itself. The bow tie diagram has 3 parts. First, the condition most likely experiencing target box. It falls in the center column of the bow tie. This is where you'll identify the primary issue. Second, the actions to take target box. It falls on the left column. This is where you'll list actions to address the primary issue. Third, the parameters to monitor target box. It falls on the right column. This is where you'll list actions that'll monitor and evaluate the actions you've taken. Oh, and see why it's called a bow tie? It's because the target boxes with the 2 actions to take and the 2 parameters to monitor are on either side of the potential condition target box. Let's run through a practice scenario. For this video, we'll give the answers as we go so you can get the flow of a bow tie item type. We'll pretend that we read the notes, and we have decided that the primary issue is hyperkalemia. So, we'll drag the hyperkalemia token and drop it into the condition box. Then, on the left side, we're going to look at actions to address the hyperkalemia. We want to think about immediate and essential actions. We see administer IV calcium gluconate, administer IV insulin, administer PO furosemide, administer IV sodium chloride. Lastly, on the right side, we're going to choose our parameters to monitor. This is where the NCLEX wants us to consider what to monitor and evaluate as a result of the actions we just picked and the conditions we believe the client may be experiencing. Possible parameters to monitor could be basic metabolic panel, ECG rhythm, muscle strength, urinary output. Pause here if you'd like to try to answer the question. If you'd like to follow this one through, stick with me. The actions to take are administer IV calcium gluconate to stabilize the cardiac cells and IV insulin to quickly decrease potassium levels. The parameters to monitor are basic metabolic panel and ECG rhythm to make sure that the potassium is going down and the client doesn't develop a dysrhythmia. Great work. Now that we've gone through the question, here are some tips to help you feel like a bow tie pro. Read the scenario carefully. You want to take in every bit of detail and information to help guide you to pick the correct choices. Use your scrap paper to write down what sticks out to you. Walk yourself through it. Approach the question systematically. What's the primary issue? Then, what actions would you take to address the issue? And finally, what should you keep an eye on to evaluate the client's condition and response to actions? When you're done, read it through to make sure the story makes sense. And remember your prioritization. What would you do immediately to help your client? While an action may be appropriate for the suspected condition, is it the priority action? Okay, here are the materials we used in this review. All right, that's it for bow ties. Understanding the structure and practicing bow tie questions will boost your confidence for test day. Remember, the NCLEX is not just about recalling material, it's testing how you apply your knowledge to real-deal nursing scenarios. Trust yourself, you've got this. If you found this video helpful, come back for more reviews, including more videos about the new next-gen NCLEX item types. If you have any questions or topics you'd like us to cover, leave them in the comments below. Find us across all social media platforms at Blueprint Nursing. Remember to take care of yourself, and we'll see you next time.